Polypharmacy, defined as the concurrent use of 5 or more medications, has become a silent epidemic among the aging population. Data reveals that nearly 40% of adults over 65 are currently managing 5 or more daily prescriptions, a threefold increase since the 1990s. I'm Dr. James. Clinical research indicates that each additional drug added to a senior's regimen increases the statistical risk of a major adverse drug reaction by approximately 10%. When these chemicals interact, they often create toxic metabolites that the aging liver and kidneys can no longer process, leading to systemic instability and organ failure. This often triggers a prescribing cascade where new medications are mistakenly introduced to treat side effects that are actually caused by existing drugs. Take care of yourself, because your health is truly your greatest wealth. The primary challenge of polypharmacy is metabolic competition. When multiple drugs enter the system simultaneously, they compete for the same enzymatic pathways in the liver. By age 70, renal blood flow and the glomerular filtration rate have often decreased by as much as 50%, significantly prolonging the half-life of most common prescriptions. I'm Dr. James. This reduction in clearance means that standard doses, safe for a 40-year-old, can quickly reach toxic concentrations in a senior patient's bloodstream. When the liver's detoxification capacity is overwhelmed by 5 or more compounds, the body enters a state of chronic subclinical toxicity, often misidentified as natural aging. Factual evidence proves that comprehensive medication reviews can identify these metabolic bottlenecks before they lead to irreversible organ damage. Identification and prevention of metabolic overload are critical steps toward ensuring pharmaceutical safety in later life. The prescribing cascade occurs when a medication side effect is misinterpreted as a new medical condition, leading to the initiation of an additional, often unnecessary prescription. Data shows that for every 5 medications taken, the probability of a prescribing cascade increases significantly, turning a simple treatment into a complex web of drug interactions. I'm Dr. James. For seniors, this cycle can quickly result in an unmanageable pill burden, where the curative benefits are entirely eclipsed by the secondary effects of the treatment itself. Common examples include treating medication-induced insomnia with sedatives, or using acid reflux drugs to manage gastric distress caused by chronic pain relievers. Statistical evidence confirms that deprescribing, the planned process of reducing or stopping medications, significantly improves cognitive function and reduces fall-related hospitalizations. Vigilance in medication management is the most effective safeguard against the silent escalation of the prescribing cascade. Cognitive clouding is one of the most insidious consequences of polypharmacy. For those over 60, the accumulation of multiple drug classes can create a persistent mental fog. Data indicates that seniors taking 5 or more medications score significantly lower on standardized cognitive tests, frequently exhibiting symptoms that mimic early-stage Alzheimer's. I'm Dr. James. This impairment is often reversible. It stems from the chemical interference with acetylcholine and dopamine, the key neurotransmitters required for memory and focus. When multiple systems are saturated with competing chemicals, the brain's processing speed slows down, leading to increased reaction times and an inability to perform complex daily tasks. Factual evidence confirms that structured medication reduction can restore mental clarity, often improving cognitive scores within just 30 days of deprescribing. Restoring cognitive independence begins with identifying the hidden chemical burden of multiple daily prescriptions. For adults over 60, maintaining physical stability is a complex neurological process. Polypharmacy disrupts this balance, turning routine movement into a high-stakes hazard. Clinical studies show that the risk of a fall-related injury increases by over 20% for each sedative, antidepressant, or blood pressure medication added to a regimen. I'm Dr. James. This instability stems from orthostatic hypotension and central nervous system depression, which can cause sudden dizziness or a loss of protective reflexes during a fall. The statistical reality is stark. Polypharmacy is a primary contributing factor in thousands of senior hip fractures annually, events that often lead to a permanent loss of mobility. Factual evidence confirms that identifying high-risk drug combinations can reduce clinical fall incidence by up to 30% through targeted medication management. Ensuring physical safety requires a vigilant evaluation of the chemical burden placed on the aging nervous system. For seniors managing multiple chronic conditions, the gastrointestinal tract often becomes the primary site of systemic drug interaction and inflammatory response. Clinical data reveals that polypharmacy is a leading contributor to drug-induced gut dysbiosis, a state where the natural microbiome is profoundly disrupted by chemical load. This disruption impairs the absorption of essential micronutrients, specifically vitamin B12 and magnesium, creating a secondary cycle of neurological and muscular deficits. When chronic constipation from opioids interacts with gastric suppression from acid reflux drugs, the statistical risk of bowel obstruction increases by over 40%. Factual evidence confirms that identifying these gut-related interactions early can prevent severe systemic inflammation and the need for acute surgical intervention. Maintaining intestinal integrity is essential for preserving the overall health and independence of the aging population. The liver is the body's primary chemical refinery. Within it, a specific family of enzymes, known as cytochrome P450, is responsible for metabolizing over 70% of all clinical drugs. In polypharmacy, multiple drugs often compete for the same P450 pathway. Data confirms that this competition leads to a dangerous bottleneck in drug clearance. I'm Dr. James. When one drug inhibits an enzyme, it effectively blocks the exit for others. This causes the secondary medications to build up to toxic levels in the blood. Statistical modeling shows that these drug-drug interactions are responsible for nearly 30% of all hospital admissions for patients taking 8 or more daily prescriptions. Evidence indicates that genetic variability makes certain seniors slow metabolizers, exponentially increasing their risk of systemic toxicity when managing multiple compounds. Understanding enzymatic competition is a fundamental requirement for safe multi-drug management in later life. Beyond prescription regimens, a hidden layer of polypharmacy exists in the frequent use of over-the-counter medications. For adults over 60, these self-prescribed treatments often escape clinical oversight. Statistical data indicates that over 80% of seniors take at least one over-the-counter medication daily, with many using supplements that directly interfere with critical heart and blood pressure prescriptions. I'm Dr. James. Because these drugs are available without a prescription, patients often fail to report them. This creates a blind spot for physicians, leading to unpredictable and dangerous chemical interactions. Common OTC drugs, like non-steroidal anti-inflammatories, can nullify the effects of blood pressure medications or exponentially increase the risk of internal bleeding when combined with prescribed anticoagulants. Factual evidence confirms that nearly 15% of geriatric hospitalizations involve a preventable interaction between a prescription drug and a seemingly harmless over-the-counter supplement. Complete transparency regarding all self-administered treatments is a fundamental requirement for pharmaceutical safety in our later years. While individual medications are tested for safety, the systemic impact of managing 5 or more compounds for years often leads to silent, progressive organ damage. Clinical data confirms that drug-induced liver injury is significantly higher in the polypharmacy population, where the liver's detoxification pathways are chronically saturated. I'm Dr. James. This chronic inflammation often leads to fibrosis, reducing the organ's ability to clear toxins from the blood, which further accelerates the accumulation of other prescribed drugs. Similarly, the kidneys face a persistent filtration burden. Factual evidence indicates that polypharmacy is a primary risk factor for the development of chronic kidney disease in adults over 60. Regular serum monitoring of creatinine and liver enzymes is mandatory. Statistical data shows that early intervention can halt the progression of drug-induced organ failure in 70% of cases. Preserving vital organ function requires a strategic and data-driven approach to reducing the cumulative pharmaceutical load. As medication regimens grow, the probability of human error scales exponentially. For a senior managing 12 or more daily doses, the simple act of taking a pill becomes a high-risk cognitive challenge. Statistical data reveals that medication errors occur in nearly 60% of senior patients following hospital discharge, with double dosing being a primary driver of preventable drug toxicity. I'm Dr. James. Complexity is the enemy of adherence. When a regimen requires multiple doses at different times of the day, the cognitive load often leads to skip doses or dangerous accidental repetitions. These dosing mistakes frequently manifest as acute confusion or sudden cardiovascular instability, which are often mistakenly treated with even more medications, further complicating the clinical picture. Factual evidence confirms that simplified dosing schedules and regular pharmacist-led reviews can reduce medication errors by 40%, significantly improving long-term safety and health outcomes. Reducing the complexity of a pharmaceutical regimen is a critical prerequisite for achieving medication safety in our later years. As we age, it's not just how the body processes drugs that changes, but how the drug targets respond. This is known as increased pharmacodynamic sensitivity. Clinical data reveals that for adults over 60, the central nervous system becomes more permeable, allowing medications to have a far more potent impact on the brain than intended. I'm Dr. James. Because of these changes, a senior can experience severe side effects even when blood tests show the drug level is within the standard therapeutic range. This heightened sensitivity applies particularly to sedatives and painkillers, where the statistical risk of respiratory depression and profound confusion is doubled in geriatric populations. Factual evidence confirms that starting with the lowest possible dose and monitoring clinical response, rather than blood levels alone, is essential for pharmaceutical safety. Recognizing the increased sensitivity of the aging body is a fundamental requirement for effective medication management. Over this investigation, we've uncovered how polypharmacy can compromise the liver, kidneys, and brain, creating a cascade of preventable clinical risks. Safe prescribing is not about stopping treatment, but optimizing it. It requires a partnership to prioritize quality of life over pill burden. When the pharmaceutical load is reduced, the aging metabolism often stabilizes, allowing organs to recover and reducing the probability of life-threatening interactions. Regular clinical reconciliation is the gold standard for senior safety. Personalized care ensures that the benefits of treatment always outweigh the risks. Take care of yourself, because your health is truly your greatest wealth. The data demands vigilance. Knowledge remains the most effective tool for senior safety. The investigation into pharmaceutical safety concludes. Factual evidence remains our best guide.